Hello, my friend, and welcome to episode number 99 on 15 mistakes PCOS women make when it comes to PCOS, right? Now, PCOS can be a very challenging experience to manage, and it's important to avoid certain common mistakes. Ultimately, PCOS is a lifestyle disease most of the times, and we are not fully aware of all the lifestyle habits that are causing our PCOS specifically. So, in this episode, I'm going to highlight 15 potential mistakes PCOS women make that can be avoided. So, before that, I want to just give you a glimpse of what's happening in my life. Um, I always wanted to weigh 52 kilos. Like, if you are someone who's been listening to all my podcasts or has been following me for a long time, you must be aware that I was like constantly obsessed over the weight 52. I'm 1.5, so like 154 centimeters tall. So 52 for me seemed like the perfect weight. It was that obsession that I need to be at that number. And I decided to let go of that goal. And I've settled that number to be 54. I did that because I'm actually very healthy physically and emotionally at that number. And it's very easy for me to maintain it. So I'm like, why am I making myself hard and like go for 52 when I don't even like 52? And since I made that decision that I'm okay with being 54, surprisingly, my weight has been in the range of 52 and 53. I don't know. That just happened. That's how our brains work. It's sort of reverse psychology. And it's right now September 2023, and I have my parents visiting me for like 2 weeks. I live in Abu Dhabi, in the Middle East, in United Arab Emirates, and I'm originally from India, so my parents are visiting me. They come like once or twice a year, at least twice a year, to visit me. I go home at least once or twice a year, depending on my child's school vacations. So right now they are visiting, and that means they got a lot of food items from India for us, which I'm consuming mindlessly. Like that's just happening. I'm just observing myself of how I eat foods which I don't want to eat. And all of these foods, not all, actually all of them are PCOS causing foods. Like they're worsening my PCOS. Like they got jalebis, which are Indian desserts made of flour and sugar. They got kaju katlis, again, a lot of sugar. Dairy, I'm avoiding dairy as well, but kaju katli has dairy in it. Jalebis has yogurt in it. They got bhakarwadi, which has flour in it. They got potato sweet chura, which has again like sugar in it and it's fried. They got shankar paris, which are like flour and sugar and fried and some dairy in it. So all the things which cause me PCOS, which worsens my insulin resistance, which cause me acne and all of that, they got. And I noticed myself not writing in my food journal for days. Like since they have come, like I think 5 days have passed, and my journal is empty. It just disappears. Like I just ghost it. And what I'm doing instead is I'm snacking with them. I'm having jaggery in my tea. I'm having sugar in my food. I'm having more of teas and coffees. I'm having chips with my meals. I'm having biscuits with tea and coffee whenever I take any break. Like all my old habits, which I didn't want to do, are all returned. They have all returned. So a lot of emotional eating. Like I'm not hungry during this time. This is just urges. These are just like old habits, which are like very much strong and urgent suddenly. And they have started again. Something which I did very regularly when I was a child. And finally, I could enter into my food journal after my body screamed with discomfort. Like it got acne. I have acne, this one on the face, and my allergies got activated. And I'm like, okay, this can't be happening. Allergies, okay, acne I can deal with, but I get cystic acne, which is like painful. It hurts. The pimple hurts. It's growing under the skin, and I have a very low pain threshold. So I just like can't tolerate pain. So it hurts. And the allergies, that's just like like my throat is so itchy in the morning, my nose is running, I get headaches, the sinuses don't like it, and that sinus headache is another pain, right? So I'm like, okay, I don't want all that because that causes me physical pain. So I'm back to journaling. And all I have to do is like literally remember only one thing, which is like return to my food journal. And suddenly like that food journal is like my temple. So I enter that temple and everything I have done is forgiven. I literally forgive myself because I look at my food journal as a place of forgiveness where I literally have made peace with whatever I have done. I don't judge myself. I'm like, okay, that happened. And we are moving on. Let's go back on track because we have a huge life in front of me. It's not like I'm dying. So I have opportunities to take care of myself every day, every meal, right? So I have another week with them, and I'm going to try to eat mindfully so that I can be nice to my body. And let's see how it goes. And if it doesn't go well, then I'll have to look into it. Okay, so let's come back to the 15 mistakes PCOS women make in PCOS. Number one is self-diagnosis. We assume that we might have PCOS without a proper medical evaluation. Many women have some form of insulin resistance, but we need to really confirm with a healthcare expert. The advantage of doing that is that we get a diagnosis. Once our brain gets to know that, okay, this is what is wrong with you, then we get into action to fix it. So our brain likes to know if something is wrong with us, and an expert can actually give you that diagnosis so that we can finally take it seriously. Now, mind you, I'm not saying that having PCOS is something like makes you sick or something is wrong with you. No, many PCOS women lead a successful life. They make peace with their obesity, they make peace with their size, they make peace with their health conditions, they stay focused in whatever passions they have, and that is all okay. But I'm not talking to them. If you are someone who wants to make peace with your PCOS, where you are okay with whatever conditions you have, this probably is not for you, because my agenda in life is PCOS is reversible, and there is a different life for PCOS women where you have to just make few tweaks in your lifestyle, and you actually get to lead a life in your normal body weight. Like you can have all those passions and this as well. So if you're someone who wants to make peace with your size, like, of course, I teach that work as well, where we want to accept ourselves the way we are and still strive to be in a healthy body. Because if you take care of this body will take care of your ideas, your aspirations, your passions. So go to a healthcare expert if you have any suspicion that you might have PCOS. That is, if you have irregular periods, if you are overweight, struggling to lose weight, if you have acne, which keeps coming, or if you have facial hair, if you have female pattern hair loss, if you are obese, please go and get checked whether you have PCOS. Maybe you don't have full-blown PCOS, as in your periods are like, okay, you have regular periods, but you're struggling to lose weight, or you're struggling with acne, back acne, face acne, or swellings in armpits, groin area. Those could be subtle signs of early PCOS or insulin resistance, right? And eventually you might get PCOS or you might get diabetes. So second, that is the first mistake where you diagnose yourself, right? The second mistake is skipping doctor visits. Now, I know there's a lot of hate for doctors everywhere when it comes to PCOS, because doctors really are not very well educated when it comes to PCOS, including me. I'm not a reproductive endocrinologist. I'm just a gynecologist who is not so trained in PCOS. What I was trained was PCOS is a hormonal imbalance, and there is the first line treatment is weight loss and dietary modifications and exercise. And if they like if they have tried that or that has not worked or they can't do that, then give them metformin, give them hormones to regulate their periods. She should have at least 4 periods in a year. Correct whatever is there, right? That's what doctors are trained into. And PCOS is like a constantly evolving condition. So doctors are updated, but still they have many other areas where they want to focus on. And PCOS is one of those chronic conditions where they don't know much, they're not trained much, they probably don't have passion in it, right? Like I had passion in pregnancy, so I would do more of more of pregnancy care, but I saw PCOS women struggling in pregnancy, and that's why I'm here, right? I had PCOS too. So not everyone is a specialist. Not every endocrinologist would be a specialist in PCOS. Not every dermatologist would be a specialist in PCOS. PCOS is like a whole different ball game, right? Like it demands a lot of other expertise in it. And for me, I have come with an expertise of mindset in PCOS. So once you figure out the mindset, then you can set any goal and achieve it. And PCOS is a lifestyle disorder where you can keep health goals like a weight or having clean skin or having regular periods or having um, mood, better mood, right? I can help you manage your mind along with your medical condition. So most patients, what they would do, because if they sense that their doctor has just told them, okay, lose the weight and come back to us when your periods, if you need to get pregnant or something, or your periods are completely haywire, you come back to us. And many patients make peace with like not getting periods regularly. They're like, just okay, whatever. If they're not sexually active, it's not a concern for them. But not seeing a healthcare professional regularly for monitoring and advice of PCOS, what will happen is it will just keep worsening, especially if you're not intervening, right? So many PCOS women would be told to lose weight by their healthcare providers, as that is the fastest and the safest way to treat PCOS. But many would not be able to lose weight on their own, and they don't return to their doctors because of the sheer failure of not able to do that. And also they know that doctor might not be able to help them. Unfortunately, this will slowly worsen your insulin resistance. So please go back to your doctor, not for medication, but for further recommendations. Maybe they would refer you to an instructor who specializes in PCOS, like a gym instructor they knew who has given people benefits, or they might refer you to a nutritionist who specializes for PCOS, or to a therapist who has helped heal trauma when it comes to emotional eating, or a life coach who can get you to move forward towards a healthy body. So do not skip those visits, because we need to touch base with some healthcare provider who can actually keep us moving forward in getting to a better health. So the third mistake that we do is ignoring our symptoms, ignoring signs like irregular periods, period problems, acne, hair loss, facial hair, weight gain. Now, these are not as scary as fever or getting really like losing a lot of weight suddenly, or like long lasting fever or vomiting, diarrhea, or urinary tract, or any sort of infections, right? It's not something that aggressive, these PCOS signs and symptoms. So we tend to we ignore it almost, like even with like irregular periods, especially if you don't have heavy periods or you're not sexually active. Most PCOS women will just ignore it. They're like, yeah, I'll just wait for it to come, or I don't really care to have a period. So they will just ignore it. But our ovulation, for PCOS women, ovulation has stopped and is causing period disturbances. There is an excess male hormone which is causing acne and facial hair and hair loss. This shouldn't be happening, and it's happening. Why is this happening, right? Like, fix it. If you don't fix it, whatever is like causing you to go into that defense, for your body to go into defense so that you don't make a baby, that's not a good thing for a female's well-being. You need to fix it, right? And it's fixable. It's not something which is that it's not unfixable, but it demands you to use your mind, right, to manage your mind. The fourth mistake that PCOS women make is lack of education, right? Like not researching or understanding PCOS and its effects. So many women are ignorant, really ignorant of this condition. Like the other day, I was in a Facebook group of PCOS, and I was just talking about insulin resistance. And this woman who was obese, BMI is like 60 or something. And I told her, like, listen, she wanted to get pregnant. And I was like, listen, you need to bring it down because it's very unsafe. You need to bring your insulin resistance down. And she had no clue what is insulin resistance. So many people know they have PCOS, but they don't know that there is insulin resistance, which is the root cause. And why is that happening? So understand that. And I have episodes on insulin resistance in this podcast as well. So if you're watching this on the video, you can go to my Apple podcast or my podcast on Spotify. It's called Metabolic PCOS Coach, and you might find one episode on insulin resistance. In fact, I'll tell you exactly. So it is episode number 8, which is insulin resistance and weight loss in PCOS of my podcast episodes, where I talk about insulin resistance. Plus, you might find guidelines. I'll reference it in the links in this, my podcast link, and some medical guidelines which can educate you on insulin resistance. And like just a patient information that most healthcare societies provide, right? Internationally. So learn about what PCOS is, right? Because women are ignorant of this problem. Their mothers suffered from it, they suffer with it. And if they didn't correct it, their children would suffer from it. So always refer to the patient informations released by doctors as a guide for PCOS awareness. Also, many doctors are not so well trained for PCOS, for non medical management of PCOS. So please follow the advice of experts who have helped many PCOS women, right? Like me. You can just review my whole podcast series to like understand what PCOS is and what you can do about it. The next mistake we do is inconsistent medication. Now, not taking prescribed medication consistently. Now, I'm not a big proponent of medications and supplements. I really don't like myself to take it, and I don't like to prescribe it to my patients because they're expensive. And also, any medication can cause side effects and allergies and other problems, right? So I'm like, can we just heal it by itself? So that's my philosophy. But if someone has prescribed you medications, please take it consistently, especially hormones and something like metformin. Like hormones, if you take it for a few days and you get side effects and you stop it, that can lead to more period problems, right? Secondly, if you're taking metformin, if the doctor has prescribed you something like metformin or glucophage, you started to take it, it has a lot of side effects, and you stop it, and then you start it again, and then you stop it again, and then you start it again, and you stop it again. It shouldn't happen that way because the side effects are most common only in the first few days. After some time, your body gets adjusted to it. But then once you stop it and then restart it, it's like the whole side effects come back again. I have taken metformin and hormones both. So I know that what is required is like the finish the course that the doctor gave you and then decide, right? See the benefits of it over the course that they have prescribed it. Also, if you are having side effects or don't want to take the medication, please inform your doctor. They can advise you on dietary modifications or can guide you to alternative medications which act like PCOS medication, like Ayurvedic medication or homeopathic, or like some sort of herbal medication, which might be similar to the effect of metformin. Now, there are some doctors who are like, no, you have to take it. You can change the doctor because not everyone is like that. All right. So if a doctor is being so strict with it and it's coming from that, no, you better do what I'm telling you to do. That's not right, right? Like she's not achieving that safety where you can trust her. So change your doctor if that is available for you. All right. Or get in touch with me, like DM me on Instagram to find out if there is anything that which is contradictory with your doctor. Many of my followers will DM me and I respond to them as early as possible. So the next mistake that we do is unhealthy diet. Consuming high sugar. This is my favorite. Consuming high sugar, processed food, flour and sugar-based foods, right? And can worsen insulin resistance. And I believe food is the best medicine. And unhealthy foods, they can act as poisons, like slow poisons, like a cigarette, right? Those who smoke, it can act. They those who smoke cigarettes, they're actually very anxious, right? And they're trying to suppress their anxiety, or they're depressed, or they're like trying to get themselves feel better when they smoke. And it works, but only for that moment. And it slowly causes harm to our bodies over the long run. Similarly, junk food, processed food, unhealthy foods is consumed by many PCOS women as a way to suppress their moods, their stressors, but it slowly worsens their PCOS. It feels good in the moment, like literally for a few moments, and then it's like causing you guilt, shame, regret in case you have the awareness that food is not good, and then eventually it's slowly going to harm your body. So that's unhealthy diet. The next mistake, number 7 mistake, is avoiding exercise. Leading a sedentary life where you're not moving at all instead of staying active is one of the causes of PCOS. We don't want to exercise until we go into a stress response or injure ourselves. I want to offer you that exercise for fun and keep yourself mobile. It's an excellent form of stress buster, any form of exercise, and is also a form of meditation where we literally forget the thinking that we are having for a few moments. Now, like from a mindset point of view, I always recommend my clients, if they can, like sit in one place and close their eyes and just sit in one place. Don't take any action, just sit. If you fall asleep, excellent. You don't fall asleep, that's also fine. If your mind is spacing, no problem. But just sit in one place, don't do anything. The idea is like just to like sit with your thoughts. That's a form of meditation. And then that you can do that the same thing with exercise, right? Like while doing yoga, Pilates, dance, like your focus is there. Like right now, my exercise is like I stay in a house which has like ground floor, first floor, second floor. So like two flight of stairs. So I climb it like 10 times in the morning, up and down, up and down. So 20 times. And I have to really focus on not falling because it's morning, it's dark, and I might fall. So imagine all that focus time is when I'm not thinking, because I have like really shitty thoughts in the morning. I don't want to like just start my day with that sort of thinking. So it's very important to shift your thinking. And exercise is one of those ways. And PCOS women don't exercise and they just sit with their thoughts and it's just like brewing, which is not good because the only way we know to feel better is eating unhealthy food. And that worsens our PCOS. Number 8 mistake is crash dieting, attempting extreme diets that can disrupt hormonal balance. Most PCOS women are obese, most of them. Some of them are lean. And we want you to lose weight, especially if you're obese, but not with a crash diet, but by eating healthy and by reducing the act of overeating. You don't want to overeat, right? Also, we need to continue this new way of eating, healthy eating, for the rest of our lives, as that unhealthy food will bring back the PCOS, right? So many women, PCOS women I know, they go on a keto diet and they lose the weight and then they just go off it after the weight loss has happened, or they just like leave it halfway because it's not sustainable. They can't just keep having it. It's expensive and they just can't keep having. And I was just talking to a client of mine. She was like, Doctor, I'm actually saving money with this healthy, mindful eating that you teach. Like I barely spend 30 dirhams a week on my food and I'm losing weight and I'm happy. I'm like, welcome to my world where it's actually possible to eat healthy and save money and lose weight, right? And feel happy and feel nourished. So that's possible. And we want to continue doing that for the rest of our lives. So that's not by crash dieting, but by mindful eating. 9th mistake PCOS women make is stress management. They fail to manage their stress, which can exacerbate their symptoms, which can worsen their symptoms of PCOS. Now, what does emotional stress do? Which is basically like constantly spinning in negative emotions, worrying, self-doubt, anxiety. All of this can trigger our fight and flight response, which can rise our cortisol, which is the stress hormone. This worsens insulin resistance. Hence, it is super important for us to find ways to regulate our nervous system every time it goes in fight, flight, or freeze response. Sometimes just taking a pause for 5 breaths, 5 intentional breaths can do the trick. And I think I'll do an episode on just breathing exercises, and I will do one episode on nervous system regulation, like what is fear response, right? And it's important, like what that fear is triggered, or that freeze is triggered, that stress response is triggered because of like circumstance which has happened, and we have had a thought about it and we are not aware of that thinking. So we want to slow down that thinking. We need to let our nervous system which is triggered to calm down. And we can do that by just taking a pause for 5 breaths, right? Like breathe in for 5 seconds and hold for 5 counts, and breathe out for 5 counts and breathe and hold for 5 counts. So I call it a box breathing. And this sort of breathing, what it does is I want you to focus in between breaths, the gaps in between breaths. That's where the magic lies, actually, right? Because that's where the brain will slow down. So try doing those exercises whenever you are in a stress response. The 10th mistake which PCOS women make is skip meals. Irregular eating patterns can affect insulin levels. Humans are creature of habit. Our bodies adjust to whatever we make it do. But if you don't have regular eating pattern, then your body will go in starvation mode, as it is not sure when you're going to eat next. So maintain a regular eating pattern. Now, I recommend 2 meals a day for those who want to lose weight. And once you have lost the weight, you can keep 2 meals a day if you want to maintain at that level. Many of my clients, we just do that. They will not go back to that snacking because it just doesn't feel good. Or you can reintroduce 3 meals a day and see if you're gaining weight. But it needs to be regular. Your body needs to know when the food is coming. You can't be like just impulsively starving yourself and then impulsively binge eating. That's not what we want to do, because no matter what, if there is no pattern of eating, your body's going to think that we don't know when the food is coming. Let's just store everything as fat because she might not get food, right? So eat regularly. Next mistake women do is overlooking mental health, ignoring emotional impact of PCOS. Every human being feels bad and good, both. As human life is 50% good, 50% bad, like on any given day. There is like sometimes it's good, sometimes it's bad, right? That's our humanity. But when we resist that 50% bad and we think we should not feel bad, the bad, it just grows, it just stays longer, as we have activated not just this current situation which we think is bad, but when we start thinking about it, I should not be having this, then it starts finding evidence of all the bad things which is happening around you. All of that is triggered. That can worsen our moods. And if you can manage to do your regular life activities like taking a shower, um, then good. But suppose if you can't manage to do these regular life activities like taking a shower or getting out of bed, meeting humans, if it becomes hard, then please reach out to be supported by a therapist or a psychiatrist who can check if you have a mood disorder and if you can benefit with medication or therapy or coaching. But you need some sort of support. So if you're not able to manage your day-to-day life, like it's impossible for you to function normally, please reach out. The next mistake is lack of support. Not seeking support from friends, family, or support groups. Now, understand, human beings We get a dopamine hit. We feel good with social connections. There is a natural pleasure in it. And that is because they can provide us that emotional connection, right? And if you don't have anyone in your life who can hold that loving space for you without judging you, please reach out to a therapist who can help you heal the wounds from your past, or reach out to a life coach who can help you move forward. All you need is another human being who can listen to you without judgment. And life coaches and therapists are trained to do that. We're trained to listen to you. And I do that to my clients, right? Like I give them a plan as a life coach. We are working with a goal. We are working on a goal. And I tell my clients, okay, this is what you're going to do. This is what we have to do. Try this out for a week. And then at the end of the week, we see what happened exactly. Could she do it? Could she not do it? What were the obstacles? Why were they an obstacle? And then we talk about that, the struggles. We take one struggle at a time and we clean that up. And then we take another struggle, we clean that up. Take another struggle, we clean that up. And like most of the time in most of my sessions, I don't do any talking. I just am asking questions. I'm letting the client figure out the answers because you have all the answers. And all the teaching that I do is here on podcasts or on my YouTube channel or my social media. That's where all the teaching happens. But in the session, you get to talk, right? So please get support. Don't ignore your mental health. The next mistake PCOS women do is overlook sleep. They don't consider sleep as important. Not getting adequate rest can affect hormones. Inadequate and fragmented sleep can cause stress response in your body, which by itself worsens PCOS. Also, inadequate REM sleep, rapid eye movement sleep, interferes with our moods. Hence, inadequate sleep can cause poor repair and healing and more illness in our body. So focus on 8 to 9 hours of night sleep. And if you're working night shift, please consider changing your profession because you need to heal your body. That needs to become a priority. The next step is overdoing caffeine. That's a mistake PCOS women do, is like they have either more chocolates or more coffee, more tea. And this caffeine in these products can stay in our body for almost 10 to 12 hours. The quarter life, half life is 5 to 6 hours of caffeine, and quarter life is like 10 to 12 hours. And if you have had a lot of caffeine throughout the day, that is going to stay till late in the night in your blood, which will affect your sleep. And it will worsen your anxiety, because in case you're not able to fall asleep and you're in the bed and you're like, why am I not sleeping? Why am I not sleeping? You're just constantly thinking, mind is pacing. It will worsen your anxiety. So if you are having coffee, excellent. No, we don't need to stop it. It has some antioxidant benefits, but have it before 10 a.m. or 12 p.m. Don't have any caffeine after that, so that it clears from your blood by the time you reach your bed. The last mistake PCOS women do is they use harsh skincare, aggressive treatments that can worsen acne or skin issues. Now, acne is caused due to external irritants like harsh treatments, or you're poking your skin, touching it constantly. But it can also happen because of internal stimulants like excessive sugar in the blood. That excessive sugar worsens insulin resistance and increases your testosterone, which can cause excess sebum production in your glands and more chances of getting acne. So first, stop touching your skin if it's not required. Like if there's no fly on it, don't touch it. Like don't keep poking. Anytime you see your hand is like on the skin like this, nope, I will not do that, because that will make you poke. It's a habit which you have practiced since you got your first pimple. And start eating clean. Remove the sugar. Remove the foods which are high in glycemic index. So I like to think PCOS is actually an emotional problem. We eat to feel better. Unfortunately, we are eating all the wrong foods, which are making things worse. I want to offer you to stop that vicious cycle of eating wrong food to feel better in the moment, just to worsen eventually. And I can help you manage your mind to let go of those food addictions. Please follow the link in the bio and set up a clarity call with me to understand what I offer in PCOS coaching. It is essential to work closely with a healthcare professional and make informed lifestyle choices to manage PCOS effectively. So, consult a doctor, a specialist, a therapist, or a life coach for personalized guidance. All right, so I'm just going to revise this 15 mistakes one last time so that you have an overview. Avoid self diagnosis, go to a doctor. When you go to a doctor, don't skip your doctor's appointments. Keep asking, when should I follow up next? Do not ignore your PCOS symptoms as they might keep getting worse. Get yourself educated for what is PCOS and what are the latest advances in it. Do not take inconsistent medication. If someone puts you on medication, finish the course and see what happens, whether it works, whether it's not working. If it's not working, get supported by a doctor. Avoid unhealthy diet, where avoid that high sugar and processed food. Avoid being sedentary, try to move every day. Avoid crash dieting. We need to eat in a healthy way for the rest of our life, and there is a way to do it. Manage your stress better. Avoid skipping meals. Don't do the mistake of overlooking your mental health. Every human being, I think, needs a mental health support. Like if you don't have anxiety or depression, you can still benefit with a life coach who can help you get to your goals faster. And that is also a mental health provider. Lack of support is another mistake PCOS women make. They sleep less and they take too much caffeine. And last but not the least, harsh skin care regimes. All right, my friends. So I hope you're not making any of these mistakes. If you have any concerns about these, please reach out to me in DM, get it clarified. I am on Instagram as Dr. Rashmi Pawar _OBGYN _coach. Please come and get supported. All right, my friend, that's it for today. I will see you next time. Bye bye.